activity was also the kickoff for our current initiative, and then slightly changed towards other expectations that we are having, like we are hoping to have advantages due to the reduced residence time when it comes to non-MAP entities, for example. We are hoping to achieve a steady state quality in upstream, and in combination with disposables, being able to run these flexible plants as we have been discussing in the morning, like Benedict. So you are probably aware that this nice picture of the Novartis MIT collaboration for continuous manufacturing, but this is focusing on small molecules and on the biologic side, and unfortunately we don't have the same budget as these guys, but we're still trying to achieve something. There are also challenges that have also been discussed today. There's increased technical complexity and the medium volume and cost. So just my personal opinion, the cost of the medium is not so much the issue, but if you think about the large volumes of medium that you have to place and store somewhere, and also the harvest, this is probably more from the operational point of view critical, just my personal opinion. So the next question mark is here, why would you start developing a perfusion process based on fat batch technologies? So what we've been using is like the standard fat batch equipment from the fat batch platform, bioreactors and controllers. We have a quite powerful process information management system already in development, which helps quite a lot. We've also been discussing the need for automation in the morning, and we've been using the same cells, media, and feeds. And you will probably think, oh, this is hell. But it works. And then basically, on these standard technologies, you attach a cell retention device of your choice. We've tested different ones. And so basically, it's the same setup, and you have the advantages that you don't have to invest too much to start such an initiative, which is always good. Also, the platform processes, they are founded on a very broad knowledge base. You can tap a lot of people for questions about their experiences with processes upstream and downstream. And one nice aspect also is that if you think about moving your perfusion process into an existing fat batch facility, this might just work if you take some constraints into account early on. Disadvantages, you have probably cell lines which are not optimum for the process because they have been selected under fat batch conditions before, and the media are not designed for the purpose, which is probably the biggest minus point, because typically fat batch media are very rich compared to perfusion media, which are less rich. So the following implications we had to take in mind. The media are not optimized for perfusion, so you cannot like have an automatic steady state like in some older perfusion processes. You see that the cell density is effectively determined by the medium. So we have to keep the cells in overflow state and actively control the biomass by automated bleeding. So in the end, we came, after like 1 year, we came up with this concept of the high density perfused batch process. We have a ramp-up phase of 4 days. Then you start perfusion and have a perfused further ramp-up up to day 10, where you reach the maximum cell density of about 100 million cells. And then you keep a production phase, which you then stop after day 18. Why day 18? So the reason for that is that this is easier to sell. Managers tend to think, okay, you have now developed a nice 13-day, 40-day process. It's very productive. Of course it's productive because it's longer. So to be within a 3 weeks time frame would like fit into an existing plant, the existing drumbeat of, for example, a pilot facility. And also you can more or less directly compare a 14-day fat batch process versus an 18-day perfusion process. So it's not too unfair because of the process length. So it's easier to sell. And also, as I said, it would work in a pilot scale environment. Yeah, we require 2 reactor volumes per day of perfusion rate, plus a feed, and we continuously harvest the process, the product. So we're not retaining it in the bioreactor as in other formats. Cell retention systems, yeah, we have evaluated several ones, internally, externally. Like the spin filter is well known within the company from the Simulate process. Also we had some first experience with the Centritech and also the BioProcess, an acoustic separation system. So we had selected some selection criteria, sorry. Like it needs to be effective in terms of cell retention, needs to be robust, scalable. So we didn't look at any technology which was not scalable, let's say to at least 1,000 liter bioreactor scale. And operability is like one buzzword to say easiness to use, how many parameters do you have to optimize, and yeah, it quickly boiled down to the ATF and the Centritech system as the two technologies we wanted to continue to work with and do an in-depth characterization of both systems. And this boils down basically to a fundamental decision if you want an open or a closed perfusion system. Open systems have some advantages because they have an inherent bleeding, so you constantly remove like cell debris and dead cells. So this is an advantage for the cell culture. Also filters will clog. That was like our primary concern about that. But they also built an additional sterile barrier so that your cell retention system is not a source for contaminations, which was another aspect there. Also, the closed systems allow a direct coupling to DSP, as has been shown, for example, by Genzyme. If you're thinking about integrated, fully continuous processes of the future, which we do in certain moments, then yeah, you will probably want to go for a closed system. This is how it looks like. So we have our laboratory built directly next to a cold room, very conveniently, with a hole in the wall where the harvest pump is pumping the medium, for example, out of the ATF into the harvest bag. Then via the bioreactor balance, it will be realized that some medium has been harvested and will be refilled later on from the cold room. Also there's antiform feed addition, like all from the fat batch process pumps. And in addition we have in addition to the fat batch process, what we don't have in fat batch is the bleed. So we use the base pump for the bleed control and the biomass sensor inside the bioreactor to control the process. And yeah, the base pump we can use because there's no base addition. The pH control is basically done by the medium exchange. So we'll show a first case study of monoclonal antibodies. So we've worked our way upwards from a process around 50 million cells. So this is the VISA count. The biomass signal would give a very nice straight line, but the VISA is more uncertain. So this is the reason for the scattering here. So we've worked our way from 50, 60, 80 to 100 million cells for the 18 days process. So compared to the fat batch triplicate shown here, this is like more than 5-fold increase in viable cell density, which is an important number because according to that paper by Pollock, which I showed before, you have to achieve at least a minimum 4-fold increase in cell density to be on the positive side for productivity, also under uncertainty because you have additional technical complexity. In terms of productivity, shown here space-time yields. We could work from the fat batch by increasing the cell density up to 700% of productivity with the high-density perfused batch process format. So there would be further improvements also possible if you think about, like we have shown in the morning in the session, like if you think about inoculating your bioreactor with a higher cell density, for example, you could intensify even a lot further. So you will hopefully be worried about the product quality. I've shown here the size exclusion results for a typical fat batch run of this process. So you can see that with increasing batch duration, the quality always gets worse. You have to admit that. While on the other hand, on the perfusion, once you are reaching a steady state, you get a very stable product quality output. And here in this case, this is from the earlier development phases, we could like achieve a product quality steady state for 2 weeks, which is very convenient and shows the power of perfusion as a product quality improvement system. Case study 2 will be on fusion proteins. What's the time? Oh, I'm already over. Sorry. So fusion proteins are not as stable as monoclonal antibodies, prone to clipping. Also, we have to use different cell lines typically that have less proteolytic activity. So we have some tools in hand, but they are definitely not as productive as our platform cell lines, of course. So the solutions would be, on the one hand, reduce the residence time in the bioreactor to avoid the proteolytic activities, switch to a more productive cell line, and intensify the process. So we have done all these 2-3 changes in one go, going to perfusion, and you can see that this difference is even more dramatic than before for the MAP case, because we can only reach like 10 million cells here, and like with the other cell line and the other process can achieve a 10-fold increase in cell density and also 10-fold increase in space-time yield. Also, what was the most interesting part for this is fusion proteins. You see after 12 days of fat batch, like 10% of low molecular weight isoforms, like degradation products. While in perfusion you see a relatively stable and very low degradation product. So it's not a perfect steady state. You can see that it's slightly increasing from like 1% to 1.5%, but it's dramatically lower, like 80% reduction in degradation products. So it's not only 10-fold more product, it's also like several percent better product. I'm already summarizing. We have developed this process in a very short time, so within 12 months, having only temporary people working on it, including me. The increased viable cell densities facilitated much higher productivities, between 7-10-fold, and much improved product quality as well. Also, we achieved for certain processes product quality steady state, which is a very nice place to be. What you can also imagine is that the biggest optimization potential will be in the medium, because we just took the fat batch medium as is. So we knew, okay, they grow, they produce something, but there are certainly different conditions in perfusion compared to fat batch. So this is like the biggest chunk that would have to be worked on next to optimize or redesign the medium completely for that. So what you want to achieve is to have lower medium flow rates. You want to have lower concentrations to make the medium cheaper, and probably there's also some potential still to optimize the performance of the process as well, because we have seen for some applications that the fat batch medium was even too rich, and so the cells were kind of suffocated from nutrients. So this is a bit of a dangerous approach, but yeah, so there's a huge optimization potential here. Also, what we want to do, I think it was also presented by TAP yesterday, to use, for example, the EMBER as a small-scale screening system, probably in chemostat mode, to perform these experiments. Further intensification, for example, by higher inoculation, and finally test the scale-up. So the plan is to go for a 200-liter disposable system, but so far I didn't find a project manager who wanted to fund these 6 cubic meters of medium. All right, I want to acknowledge the head of our continuous manufacturing initiative, Bernd, my supervisors, this series of students that have contributed to this project. We got some automation support from our USP development colleagues, also from the IPC IRD teams. For the USB team, I should mention the medium kitchen. They had quite a lot of work on their shoulders. And with that, I thank you for your attention.